Our first guest came to Niagara in 2021 as the region's Associate Medical Officer of Health. In April, Dr. Azim Kasmani took on the top job in the department as Niagara's permanent Medical Officer of Health. Doctor, the pandemic is now behind us. What is your main focus at the top job right now?
Yeah, so there's a couple of things we're really looking at. One of them is recovery. We've come out of this hopefully once in a lifetime event. There's a lot of stress in the community, amongst our staff, having some time to rest, recharge, and then catch up on some of the things that we didn't have the same opportunity to address because we were so focused on the pandemic during that emergency period.
And that means a lot of those vaccinations that we get throughout our lives that we may have put off for those 3 years.
Yeah, or we didn't have an opportunity, for example, to go out into schools and administer our school-based vaccine program. So making sure that the young people in our community are protected against things like meningitis, hepatitis, and HPV, for example.
And that's that package of shots in grade 7, right?
Correct, yeah. Yeah, and then there's also our childhood vaccinations where you didn't get the same opportunity to go out and see the family doctor. So things like measles, really important to protect against.
Has public health begun heading back into the schools?
Yes, yeah. So we've had a number of catch-up clinics. As well as that, we have our COVID vaccine clinic. You can also get your other vaccines there to get caught up.
We've been dealing with some poor air quality right now from the forest fires. And again, this is something that public health is kind of vigilant about, getting the message across how to handle this.
Yeah, so usually air quality events are localized, and that shows the importance of local public health. Unfortunately, because of the forest fires, we're seeing bad air quality throughout much of North America, or large parts of the Northeast United States, as well as Ontario, Quebec. And so it's become a much broader issue. In Canada, we use something called the Air Quality Health Index. It takes 3 factors, it puts them into a complex mathematical formula and spits out a number between 1 and 10 or above 10. And then there's certain recommendations associated with each one. And so we're looking at that, we're providing that information to the public, and it's really across the province right now that everybody's looking at that.
Let's go back into your background a little bit. Grew up in Brampton and went to school at McMaster University first. Your first job in public health, is it here in Niagara, or did you work in public health before this?
So when I after my medical school, I went and did residency training. And that residency training, I ended up doing a fellowship in public health and preventive medicine. So that's training to be a public health doctor. So I had the opportunity to work with Dr. Kieran Moore when he was in Kingston. He was our program director before he took his new job. So I worked with him. I worked with a couple of other medical officers of health in Hastings, Prince Edward, and Belleville, as well as Durham and York.
So when the pandemic hit, you were in Kingston training. What was that like? You were thrown right into the fire.
Yeah, so I actually started in January of 2020. I was in Belleville, and that's when the first evacuation flight from Wuhan to Trenton was taking place. And so from that time, we've been involved with COVID-19.
Now, you mentioned to me before we came in here that you had a chance to go on air with your TV in Kingston. What were you talking about at that time?
Yeah, at that time, it was all relatively new. We were still learning. We were putting into place different measures to help protect the public. We didn't have vaccines yet. So I think all those clips are available on Facebook or YouTube. But it was a good opportunity to talk to the public and let them know what they could do. I think there's a very captive audience who watches your TV. At that point, we were thinking about masking. We're letting people know about physical distancing, stay home if you're unwell, and the different measures we could take.
Really, when you look at it, there couldn't have been a better way for you to learn how to be a medical officer of health, how to lead a public health department than that pandemic.
Exactly. It's hopefully a once-in-a-lifetime opportunity that we won't see again for a while, such a large-scale public health issue. But there's nothing like actually just going and having to do the work.
I've said this a number of times during the pandemic, before COVID-19, you could stop 20 people on the street. No one would have known the name of the medical officer of health. But that became, on March 13th, 2020, such an important role.
Yeah, it used to be a lot more of this when there was a lot more infectious disease, but we've done such a good job with prevention that we're able to work in the background. So if you go to a restaurant and you don't get sick from eating there, if you go get a tattoo and there's not a high risk of getting something like hepatitis, as well as if you look at smoking prevention, all these other types of things that we do day to day, we're usually able to do in the background to keep the broader community safe.
And that's what you're focusing on right now.
Exactly. We need to, so some of that work had to be deprioritized because we had to deal with this acute threat. And so now we're going back and dealing with that, or we're catching up where we could. And then there's other acute issues that have popped up as well. We look at opioid deaths and substance use, for example, as people spent more time alone, rightfully so, to protect themselves. Some people, we see that there were a higher number of opioid overdoses, for example, during the pandemic. And so now it's making sure that people are safe and there's options available to them.
Dr. Kasmani, thanks for coming in today. Great to meet you, and I'm sure we'll be seeing more of you here on The Source.
Thanks for having me. Really appreciate it.